one thing I'll say is that it's so much more important to think about your actual health, how you feel inside, and not solely focusing on how you look on the outside. Hey everyone, welcome back to my channel. My name is Rosie, and I've been a dietitian for almost 7 years. And today I want to talk to you about something that is really important. Yesterday, I went to a Black wellness panel where there was a bunch of different health professionals, and basically, they were talking about the importance of health for Black people. And we got into conversations around nutrition, physical activity, and preventative versus corrective or treatment in medical care. So, what I mean by that was there was a big emphasis on the fact that a lot of Black people specifically don't go in to seek support for their health until something bad happens to them. So, it's not that they're taking preventative measures, they're only going in when something really bad happens. So that might look like you having frequent migraines or frequent pains in your stomach, but you just neglect them until something really bad happens where you can no longer neglect the feelings anymore. And as a dietitian, this is something that I have noticed myself in my experiences with patients and clients. A lot of the times, people will notice that something is not going right. And instead of actually going in to seek support for whatever they're feeling, they'll just put it off. And they'll say things like, it's just a little bit of pain. I can just take Tylenol, or it's nothing. So, really dismissing those feelings that they have, which could be a sign of something serious. And the other thing that was not necessarily surprising, but just a reminder of some of the inequities that exist when it comes to the health of Black people and other people of color. That a lot of the people on the panel that had their own private practices, they said a lot of their clients, although they would like to serve more of the Black community, that a lot of their clients weren't Black. One person mentioned that out of like 100 patients he would see, only five of them would be Black because that particular service that he offered was not necessarily covered under our universal health care. And a lot of Black people, unfortunately, are not going in for that preventative treatment. So, this video is not at all to generalize the whole Black community, because obviously that's not the case. Everybody is different and everybody views their health and wellness very differently. Some people, the littlest pain they feel, they're going to get that checked out. And for others, it's not until they're like on the floor, collapsed, having difficulty breathing, or their pain is so bad they can no longer walk, that's when they go in. There's a wide spectrum and everybody's different. The point of this video is that at this panel, I met these two lovely ladies, and one of them had asked me, because I told them that I was a dietitian, and one of them had asked me, what is something that you see on social media that you think is so outlandish and so false? And that question really was interesting because I don't actually see a lot of things on social media that are not evidence-based, because I do follow a lot of health practitioners that have the proper regulations, who are regulated and who have the proper training. So I don't tend to see those things online, but I hear things from people. I get questions all the time. And we started getting into the conversation around weight loss, which is a huge thing. And a lot of people are so fixated on how they look and not necessarily how they feel. And that's why the weight loss industry is so big, because they convince you that you have these problems that you don't actually have. Because even though your health could be great, if you don't look like what is conventionally beautiful or thin, then somehow there's something wrong with you. Anyways, so we got into this conversation around how one of the ladies said her sister is someone who tends to follow a lot of these trends online, and she'll cut out a whole bunch of things for a couple of months. And then after those couple of months are done, she'll just go back to how she was eating and even worse. And that was a perfect example of why we say diets don't work. And I think sometimes there's not enough of the education around what that means and why they don't work. But in that case, for example, if you are cutting something out of your diet completely without actually knowing why or how that particular food or those ingredients impact your body, you're not learning anything. You're just cutting them out, but you're not learning anything. And that is the biggest gap that I see. Even when we talk about things like Ozempic and all these like weight loss drugs, people are getting results, sure, but do you even understand why? Do you even know what certain hormones are being impacted by those medications? Do you know what's happening to your body? Do you know why it's causing you to get those results? Probably not. And I actually have seen a couple of things where people have shared that they were on these medications, and then once they stopped, they gained all the weight back, if and more. This is why we say that diets or being super restrictive doesn't work, because you're not actually learning anything. You're just removing something instead of learning about the reasoning behind what you're doing, or learning even how to actually get the result you want and not trying to use a quick fix. And I think in our society, especially in North America, we are always trying to find a quick fix for any and everything. And that is not sustainable. So whatever you do or whatever you're thinking about doing, you want to understand the reason why, and you want to understand how did you get there to begin with. If you do want to change your shape or change your body, you need to understand your habits. You need to know your triggers. You need to actually know what you're even eating, even monitoring that, instead of just taking a medication that maybe reduces your or increases your satiety, but you don't actually learn anything. You don't even know how to make what is considered to be a healthy, nutritious plate. So, yeah, that was an interesting conversation that we had. And the question came up is, what is one food that you would tell someone to never have? And honestly, there's nothing that I can think of that I would say with my full chest, never have this food. I don't see food as a bad thing, right? Even a chocolate bar, a piece of cake, cookies. So there's nothing that I would say to not have. And I think that people find that to be the boring answer. That's why they tend to look for these very restrictive things to say, yeah, I'm doing this or I'm doing that, or I cut this or I cut that. It's a conversation starter. Maybe you feel like it makes you more interesting. But in reality, there's nothing that you can't have. It's really, as boring as it is, having moderation, having variety, having balance, and learning about foods and how they react to your body as an individual. So that is not the sexy answer, but that's the truth. And whatever diet you want to be on, it's the diet that works for you, right? It's something that you can follow. That's something that you can maintain over a long period of time. And it's not even necessarily to view it as a diet, to think about what can I add to my diet and what can I add instead of what I have to remove. So overall, yeah, it was an interesting conversation and an interesting panel. And it's unfortunate that a lot of people don't pay attention to their health until something bad happens. I noticed that in my own experience. I noticed that when I was starting my one-on-one counseling practice, that people just didn't want to pay for their nutritional health unless they had a specific condition. And I was more interested in just getting people excited about their health and paying attention to their health and nutrition. But most people aren't that interested unless it's tied to a specific issue. And I get it, because in our society, I don't think we necessarily value wellness to in the way that it is just a part of life. It's more portrayed as something like to check off, like a checkbox, instead of integrated into your everyday life. Anyways, that is what I have to say about that. Overall, I think one thing I'll say is that it's so much more important to think about your actual health, how you feel inside. What are your biomarkers saying? Your blood tests, what are those things saying? And not solely focusing on how you look on the outside. Because there's a lot of people who might have this conventional standard of beauty, have this conventional body that society puts on a pedestal, but they are not doing well. Yeah, it's important to consider those things and to make your health a priority and to not wait until something bad happens to you.
So, one thing I forgot to mention is that in Canada, we have universal health care, but we do have a problem with having enough doctors and medical providers. So, that's another area where it is so understandable why people don't necessarily go seek preventative health care, because often, if you don't have a crisis, you're not going to be seen. And then for my American viewers, the fact that you have to pay for everything is a huge barrier, especially when Black people are earning less to other racial groups. So it is understandable. But like I said, going back to the fact that there's a lot of things that you can do to prevent illness that don't cost additional money. But I wanted to put that caveat there because I do understand the systems that exist that prevent people from actually seeking support. And there's so many other things, even like your experiences within in the healthcare system, like experiencing things like racism, discrimination, just not actually getting the support you need when you go seek help. So there's so many factors, and I understand that. But this is more to just talk about the fact that there are things that can be done that are preventative, and that we shouldn't wait until something really bad happens before we get things checked out.
A question came up about maintaining good health, and this woman asked, is there a specific formula so she doesn't have to think too much about it? And it was interesting because she had talked about how she has a very busy lifestyle and work demands a lot of her time. And I think that's the experience for a lot of us, where we have all these priorities, whether it's work, family, friends, and our health tends to become neglected. Even though, in order to be able to do all the other things, we need to make sure we're good, because if we're not around, those other things can't happen. But it was interesting, the question around her asking if there was a specific formula that she should follow. And as boring as it is, it's not sexy, it's not really a conversation starter, but there are specific guidelines around diet and physical activity provided by each country. They recommend how much resistance training you should do per week, how much cardio you should do per week, what your plate should look like. And that's the formula pretty much, because a lot of it is around having your fruits and vegetables, drinking enough water, having healthy fats, having lean proteins, having fiber, reducing your sugar, reducing your sodium, being social, being active. And yeah, that's it. It's really not that interesting, not that it could be fine, but it's not something to that most people get excited about. And there's so many other factors that go into why people don't necessarily do those things or understand those guidelines. And that's a whole other conversation. But in terms of having a formula, there are guidelines out there that exist. Instead of listening to a wellness influencer that really has no qualifications and is only sharing their lived experiences, maybe you should look into the evidence and should look into following people that utilize evidence-based practice. But I will say that I understand science and I understand how research has neglected communities and has taken advantage of certain communities. So it's completely understandable that there wouldn't necessarily be all this trust in the research. I get that. Also, just listen to yourself. If something is sounding off, they say where there's smoke, there's fire, right? Instead of listening to people who are sensationalizing health and making you afraid of certain things in order to sell their products, maybe take a step back and to tap into what your body actually needs and what your body actually is saying. And I think it's important to pair evidence and your lived experiences as well, but to make choices based on information and facts. I think why don't we start there? Why don't we start there? That's all I wanted to share with you today. It just was something that was on my mind. It was a really great conversation and got the gears in my brain turning around specifically like the Black community and getting people more focused on preventative healthcare. And one other thing that I will add is a lot of this is stuff that you don't have to pay for. You don't have to pay for fancy fitness classes. You don't have to pay for fancy food from expensive grocery stores. A lot of stuff is just very basic things that can make a huge difference for your life and for your longevity. So I will leave you with that. You know what? I want to hear from you in the comments. One of the most strangest social media wellness trends or health trends you've seen, online because I am not informed. I want to know what's going on. I want to know what people are saying online. So let me know in the comments something that you've heard or even something that you've tried and you thought to yourself, this is questionable. So, anyways, that's all I have for you for today. Thank you so much for being part of this community, and I will see you in the next video.